recently went off the NAMI board. I was the vice chair.
Oh,
So I'm here
wow,
for-
terrific.
Yeah, and I work at UVM Medical Center.
Lindsay Hunt. I work at NCSS at the Parent Child Center. These ladies.
Wonderful.
Hi, Danny Roberts with NCSS. I'm our director of community relations.
And you can introduce yourself again for the record.
Amy Irish. I work for NCSF and I oversee our school-based behavioral and clinical services.
So the committee is Health and Welfare Committee. Senator Morley stepped out for a minute, but we'll introduce ourselves.
John Benson from the Orange District.
We'll see you. Ginny Lyons, Chittenden Southeast.
Whereas England Rock do live at Chittenden Central.
So thank you for being here.
Of course. Of course. You want me to start?
Go right ahead.
Okay, I'm gonna put how much, 5 to 7 minutes?
Yeah, that would be good. That would be
All
good.
right, because I had to, well, I'm close. Okay. So good morning. And thank you so much for having me today, and thank you for your commitment to mental health, substance misuse, and addiction. I come to you today through lived experience with my twins and the challenges we have faced. One was met with a healthcare system that worked, and one was not. Mental health care is certainly healthcare. My name is Carrie Kelly, and I live in Grand Isle. My longtime partner Greg and I have been there for many, many years. We have a blended family of 5 children, 3 27-year-olds, 25-year-old, and a 22-year-old. I want to talk a little bit around my passion for mental health and what brought me to NAMI. I have been in the nonprofit sector for 35 years, volunteered for many organizations, about to be terming off the State Rehabilitation Council. I served as the chair of the Advocacy, Outreach, and Education Committee and the chair of the council. And I'm also a mental health first aid instructor. I'm also an instructor for a program called QPR, which is Question, Persuade, Refer, which is a suicide prevention program, and mental health literacy. So I come to it at many, many different angles. If you're certified in mental health first aid, good for you. If you're not and want to find out more, feel free to reach out.
We've had folks that talk with us about that.
Excellent.
We put some money into a grant, so
Nice.
That's great.
That's great. Well, I'm sure I know who you've been working with. So she and I work closely together. So my twins are going to be 28 years old a week from today. Calvin and Jackie were born in 1998, right at the time of the ice storm. And as they started to crawl and walk, we noticed a physical challenge for Jackie. In January of 2000, she was diagnosed with a form of muscular dystrophy called spinal muscular atrophy. Working through the medical community was so easy with her because it was a formal diagnosis and something that they could actually see. In 2020, she graduated from Providence College. In 2022, from the University of Leeds in England with her master's degree in disability studies. She currently works for the Vermont Department of Health as the emergency preparedness specialist for Franklin and Grand Isle County. All in all, healthcare system did it with what it was designed to do. Calvin is the longer story where mental health challenges early in his life moved towards addiction in his teenage years. They went to daycare together, they went to Grand Isle Elementary School, and that's where problems started to arise. As they hit the doors for kindergarten, we noticed that there was some mental health challenges that were starting to appear for him. And by the middle of first grade, the school had decided they could not teach him, and they sent him to the Baird School through the Howard Center. He stayed at the Baird School for 4 years before the Grand Isle Elementary was able to bring him back in 5th grade. During that time, as you can imagine, he lost a lot academically. He learned some strategies. However, a lot was lost academically. A lot of meetings with the school, the principal refusing to bring him back until he could stay in the classroom for 80% of the time. The problem was that the challenge was that the activities going on in the hallway would create any child to want to know what was going on. So he physically could not stay in the classroom. The same pattern repeated through elementary and high school. It was crisis, short-term response, and then returning to an environment that really wasn't built to support him. When he was 9, he was admitted to the Brattleboro retreat for having a suicide plan in place. I drove into the retreat on Friday, April 13, 2007, in a driving rainstorm and a scared child in the back seat. He returned home that Monday after I was told that he needed intense counseling, but the safest place for him to be was physically with me. I was so happy to go pick him up, as you can well imagine, and at the same time frustrated and heartbroken. As a sophomore in high school, he threatened to quit school. We worked with the school to quickly design an apprenticeship model that kept him attending school and working at the local auto repair shop. It was because of this shift that I was able to watch him walk across the stage in June of 2016 to receive his diploma. Shortly after graduation, he obtained Class A CDL driver's license and was trying to figure things out. Because of his mental health challenges and not receiving the support from the medical community that he needed, he bounced from job to job for a while. Drinking increased, and the path that he was on was leading to self-medicating with alcohol, to addiction, to run-ins with law enforcement, turning himself in twice for DUI, which was a big cry for help, and spending a night at Northwest Correctional Facility in St. Louis. I'm sure you've all heard the stories about the family sitting in the emergency room with family members in crisis for days, waiting for help, resources, and connections. I have been that parent a number of times. And as helpful as the staff at the ER try to be, it's not their specialty. We have met peer recovery coaches from Turning Point Center, and the work that they do is incredibly helpful, as is a recently opened mental health urgent care. These programs work, but they are crisis response tools, not long-term recovery solutions. So when I picked him up from the correctional facility, he looked at me and said, "I'm done. I need to find something that's going to work for me, or I'm going to end up in jail or worse." So he started the work. He's the one who did the research on all programs throughout the country. We soon found out at the time that there were 4 programs in the state of Vermont, none of them taking for people for more than 2 weeks. He needed longer help than that. 2 weeks is really detox, it's not recovery. So he found Mountain Valley Recovery based in Holden, Utah. It took us about 3 months before he finally got on the plane and headed towards Utah. And here's kind of where the sticking point is. I worked with Medicaid, which he was on at the time because he was 27. He'd just gone off our health insurance at the age of 26, 6 weeks prior to all of this. Medicaid actually approved this program, which they had never done an out-of-state program approval. The problem is that they said to me, "We will provide $23,000 in coverage." I was elated, at least it was something. The program was a $7,500 a month program. What we found out later was that they said this is payment in full. The program either has to accept the $23,000 as payment in full, or you need to pay for it out of pocket. The program couldn't accept $23,000. This is a $100,000 program. So needless to say, we had to let the Medicaid offer go. I had to clean out my 401k. I took out a second mortgage. I leaned on a little bit more community resources. His dad is absent, by the way, living in Panama. All told, I spent about $110,000 to get him through treatment. I didn't have that money handy at all. Like I said, I worked in the nonprofit sector for 35 years. My last employer was the United Way of Northwest Vermont for 8.5 years. I worked at the chamber, where I saw many of your faces at legislative breakfast during my time there. So my message to you really is, we need to come up with strategies in Vermont for longer term care. Calvin's program was supposed to be a 9-month program. Because he relapsed in month 3, he ended up staying 12 months. $7,500 a month plus all the other stuff that I had to pay for is how we came up to $110,000. It's really, really critical. I feel if we want to keep our young people in Vermont, we need to have the resources available to them to get the help that they need. Calvin, he was just here over the weekend. He's doing awesome. He's living in the state of Wisconsin. He's a tow truck driver. He's been sober for 18 months. It worked. When working with the congressional delegation, my question to them was, if it's costing us $100,000 plus a year to incarcerate somebody in the state of Vermont, and a lot of those people incarcerated have mental health challenges, why can't we work with people to use that funding to help maybe support a program that they would flourish in and become contributing members of society. The delegation was awesome to work with. Of course, we ran into a big wall and Calvin needed to get into treatment. So my message really is, you know, if we want to keep them here, we need to develop longer support. You know, I thank you so much for your time. Happy to connect on anything. You want to learn more. This is a very high level synopsis of my story. But we need to unite really to make real change. And I appreciate all the work that you are doing.
Thank you.
Thank you.
And for what you've been through, it sounds a full-time job.
Well, he was worth saving. And he served as a volunteer firefighter in Grand Island, South Hero for years. He's a really good person. He wants to become a peer advocate.
Oh,
So,
that's great. Bring
yeah.
it home.
I don't think he's coming
We
back.
can use it. We can use it. We are working on recovery residents, for, substance use disorder this year, trying to get that system in place. But we're also, the mental health system is the other part of it.
Right.
We also have to work on. So you just brought us another load of work that we look forward to.
Yes, well, thank you. I appreciate your time.
Yeah, thank you.
Of course.
As a mother of a mental health counselor, I appreciate what you folks are all doing.
Yeah.
Thanks.